Hey everyone! Today we will be presenting on perilymph fistulas. Super cool! So get ready to learn all about it. We have several objectives to cover today. Understand the causes and symptoms of a perilymph fistula, identify what the audiogram for a perilymph fistula would look like, interpret additional audiometric assessments and how they would appear, describe other diagnosis methods and treatment options, and analyze implications of research on perilymph fistula repair and hearing loss. Here we go!
Now you may ask, what is a perilymph fistula? A perilymph fistula is an abnormal tear or defect in the oval window, round window, or otic capsule. This causes the perilymph fluid to leak from the inner ear and cochlea out into the middle ear space. That sounds crazy, right? How would you create a hole in the oval or round window or otic capsule? Well, it is behind the tympanic membrane, ossicles, etc. This can be caused by head trauma, pressure changes due to scuba diving or flying, and congenital defects or even infection.
This doesn't sound pleasant, does it? Well, here's a list of potential symptoms for someone who has a perilymph fistula. Remember, each patient will exhibit different symptoms and to different severities. They may have earfulness, fluctuating hearing, dizziness without true vertigo, motion intolerance, vertigo, sudden hearing loss, tinnitus, pressure sensitivity, Tullio's phenomenon, which is a sensitivity to loud noises. Symptoms may get worse with changes in altitude or increased cerebrospinal pressure. Patients with PLF should try to avoid fast elevators, airplanes, traveling in the mountains, lifting heavy objects, intense physical activity, coughing, and even sneezing. If patients present with so many symptoms, then why is it so hard to diagnose? It's hard because the puncture is so small. On top of that, the perilymph fluid is clear and there are many different causes which display different symptoms. Many of these symptoms are also found in a variety of other auditory disorders. We must eliminate options based on a variety of factors and comorbidities. When you think about it, audiology is a lot like investigative science.
There's no positive way to diagnose a PLF. Some of the ways include hearing, balance and fistula test, exploratory tympanotomy with microscopic visualization, endoscopes, and rapid fluid analysis. But the most common way to correctly diagnose a PLF is by an exploratory tympanotomy with microscopic visualization. One of the most important components in the diagnosis of PLF is the patient's history. A history gives a comprehensive picture of a patient's risk factors, such as previous head trauma, otologic diseases, malformations, surgeries, meningitis, and more. Understanding a patient's history is essential to making a diagnosis of PLF. Previous syndromes, barotrauma, etc. could indicate increased likelihood of PLF over another condition with similar symptoms.
There are many additional audiological assessments though. Perilymph fistula impacts the oval window, round window, or otic capsule of the cochlea. So the outer ear and middle ear are preserved with impact specifically on the cochlea of the inner ear. This results in abnormal OAEs, or reduced or absent sound production, normal TIMPs, which measure tympanic membrane function, normal ABRs from the auditory nerve onward, and normal acoustic reflexes within expected range for hearing loss severity, because the muscles on the inner ear, the stapedius and tensor tympani muscles, are not impacted. One of audiology's favorite tools is the audiogram. An audiologist must analyze all of the history, test results, and persistence of symptoms to diagnose with PLF. The results help them identify which ear and how severe the symptoms are.
In non-emergency cases, it is good to get a second professional opinion. If there is no reasonable cause for PLF, or if bilateral fistulas have been diagnosed, it is likely that the diagnosis is incorrect. PLF is difficult to discover, and if the symptoms persist or continue to worsen, an exploratory tympanotomy is performed to look for signs of perforation. When diagnosed with PLF, the next step is surgery. This operation requires anesthesia and is performed through the ear canal. In order to repair the tear in the oval and/or the round window, The eardrum is lifted up to show the stapes, and tissue grafts are placed around the stapes footplate and the oval and/or round window, depending on the affected membranes. The surgery can last anywhere from 45 minutes to an hour. Post-surgery, the patient is restricted to the amount of physical activity, including lifting of heavy objects of more than 10 pounds for up to 1 month, then limited to or restricted contact sports after the first month to avoid reoccurrence of PLF.
To study the effects of PLF repair, several research studies have taken place. The House Ear Clinic conducted a longitudinal study with 86 patients over 12 years. The patient's symptoms included mainly dizziness and hearing loss, and 1/3 of PLF patients had a history of ear surgery or trauma. The researchers found that after surgery for PLF, hearing recovery was unlikely.
The PLF repair should be recommended cautiously, especially in children, as it has not been shown to cause hearing improvements. It can, however, help with balance and dizziness. There you have it, friends, the perilymph fistula.